An aneurysm is an overly enlarged blood vessel where the diameter is considerably larger than the normal size of the artery around it. Aneurysms can be caused by genetics and a strong family history. Aneurysms can also be caused by atherosclerotic disease, most commonly also associated with a history of smoking. Aneurysms are usually diagnosed either with screening tests or incidentally found on scans that were done for some other purpose. Typically, we recommend surveillance screening for men over the age of 65 with a history of smoking, a one-time ultrasound screening. However, if you know that you have a strong family history of aneurysms, I would recommend that you undergo screening or surveillance ultrasounds earlier than that. Or if an aneurysm is found on other imaging, to be referred to a vascular surgeon to have a thorough discussion of risks and benefits and options for management of these aneurysms, because not all aneurysms are created the same. For a certain percentage of people, their aneurysms will continue to enlarge, and as aneurysms enlarge, they do increase the risk of rupture, which is a life-threatening event. Depending on the aneurysm and what blood vessel it's associated with, our typical recommendation is for aneurysms over 5 centimeters to be evaluated for possible repair, which can mean either open or endovascular repair. However, there are certain circumstances under which we would suggest repairing these sooner rather than later, even if they're not 5 centimeters. So just like for other vascular diseases, we have a range of treatment options available for aneurysms depending on the blood vessel they're in and depending on the size and the shape of the aneurysm. Broadly speaking, for infrarenal abdominal aortic aneurysms, our two main treatment options are endovascular exclusion with a stent graft and traditional open repair. We are the only board-certified vascular surgeons in the area that can provide complex vascular care. The good news is Fox Valley Surgical has the skills, techniques, expertise, and board-certified vascular surgeons to immediately address these issues for you.